Hello everybody, and welcome back to my channel, Loving Your Life with Mama D. And of course, I'm Glenda Davis, aka Mama D. And today is Glow Wednesday. Today we're going to be talking about diabetes. This past weekend, I went to a fashion show. It was to bring awareness to diabetes. It was a young lady by the name of Crystal Davis, and she just went over the top. It was really a phenomenal show. So I have a few clips of some of the fashions, and we're going to talk about diabetes. Yes, there's so many parts of diabetes, and there's so many people living with diabetes who don't even know it. Okay, so if you're interested in that content, stick with me because we're about to get started. Living with diabetes. So what is diabetes? I'm going to give you the simple answer to diabetes. Diabetes is a chronic condition that occurs when your body can't process the food that you eat into the proper energy. It's just that simple. The food that you eat is not being processed in your body. It has to go to that pancreas and it has to produce the proper amount of insulin so that your A1C will be at a normal range and your body will not suffer from all the complications, all the many complications that are involved with high glucose. Just that simple. Okay, there are 4 main types of diabetes. I would say 3, but I'm going to put the 4th in this category because it is so prevalent with so many. So the first type is type 1. It used to be identified as juvenile diabetes, but nowadays so many adults are now being diagnosed with type 1 diabetes in their adult years, never through their childhood, never through their teens, but became adults and then was diagnosed to type 1. And type 1 means that your pancreas is not producing any insulin. So you have to go straight to taking insulin shots. And it is not pretty. It's just not fun, but it is manageable. Then there's type 2 diabetes. When you are producing enough, you're producing insulin, but not enough, okay? And most times you're prescribed medications from your doctor, but it can also truly be managed through your diet. Because you are what you eat, and that's what your body has to do. It has to convert the food into the proper energy, okay? So that's 2, and that's probably the most common around the world is type 2 diabetes. Then the new diabetes is type 3, which is known as Alzheimer's, okay? And studies are showing that food can even help in that case as well. The 4th is the gestational diabetes. Gestational diabetes is when you are pregnant and you develop a kind of a temporary diabetes, okay? And it has to be managed through your doctor throughout your pregnancy to ensure a healthy birth for you and the baby, okay? So without further ado, we're going to get into the fashion show. I think Crystal Davis did a wonderful job, and she really worked hard to bring this fashion show to fruition. And I'm going to show you some clips of it right now. Okay, let's get started.
It's actually an immune panel that looks for those antibodies that attacked your pancreas in the first place to cause the type 1 diabetes. So it's important, again, if you have a family history of type 1, to also be screened for type 1. Again, most kids who are diagnosed with diabetes are diagnosed with type 1 diabetes, but we have a growing population of type 2 diabetes as well. And again, type 2 diabetes is associated with lifestyle modifications, nutrition, diet, and exercise. And so we always encourage all kids, whether they have diabetes or not, to get off the screens and get exercising, all right? So the recommendation for physical activity for adults is 150 minutes a week. For kids, it's 60 minutes a day, all right? So get out there and play, all right? I want to know in the audience, does anybody have any questions about diabetes?
The condition where the body blood glucose levels are higher than normal, and they call it hypoglycemia, resulting from the body's inability to use or So this is a type of diabetes that only is developed during pregnancy now. And it usually disappears once the baby has been delivered, but it can increase the risk that the mother will develop diabetes afterwards. GDM is managed with real diabetes, which is not a long term recognized by the American Diabetes Association, but it is borderline diabetes, and sometimes it can be used to describe pre-diabetes. So, which is a condition in which blood glucose levels are higher than normal, and having a stroke, all these things can become imperative. And that's something that you never want to have if you have diabetes, okay? Because it is harmfully infections of diabetes, such as damage to the eye, the heart, the blood vessels. It can also damage your nerves. Ms. Diamond is here representing brittle diabetes, and this term is recognized or not recognized by the American Diabetes Association. It's sometimes used to describe when a person's blood glucose levels move in extreme from low to high, or they go from high to low. So that is what happens when you have brittle diabetes. It can go up and down real quick. It is nothing anybody that makes insulin, and it's helping you with your digestion. The pancreas is located behind the lower part of the stomach, and it is about the size of a hand. Don't she look so pretty? Give it up. Work it, girl. So well, look at that. So, girl, this is a condition characterized by high blood glucose levels caused by a lack of insulin, and it occurs when the body's immune system attacks the insulin, producing beta cells in the pancreas and destroying them. Okay? Okay, this is A1C, a test that measures a person's average blood glucose. That's right. Kidney and kidney failure. Kidneys are two organs that filter waste from the blood to remove urine, okay? Now the kidneys are located in the middle of the back, and they send urine to the bladder. She is here representing dialysis. Now this is a process of where you're cleaning the waste from the blood artificially. The job is to normally done by the kidneys, right? So the kidney sleep is a sleep like snake in which a person is not conscious, okay? And they may be caused by hypoglycemia, which is of your blood sugars, or it can be caused by low blood sugars. We make nutrients that we need in our food, okay? Food that provides ketoacidosis, which is an emergency condition in which high blood glucose levels along with a lack of insulin specializes in treating people who have allergy, pneumatic, no nephroproperty, and precious. This is a hormone that helps the body use glucose for energy, okay? And when needed, so pretty. Earlier, but a pancreas, they need donors. They need people to give up parts of their body, so that way they can join us looking pretty in her blue. Glucose levels. It is caused by the lack of insulin. Plastic tube that ends with a needle insert. It's a blood glucose. And lightheadedness, sleepiness, and confusion can all be caused. Injection.
This way.
Episodes of low and high blood pressure and high blood sugars. It's a common in people who have diabetes. If left untreated, red blood cells is less than normal, resulting in less toxins such as an allergic reaction to something. There's really a problem. Specialist, okay? A healthcare professional.
Yeah. Oh no. Okay.
Glucose levels is very important. And so that's loss of the vision can make things perceptual how much insulin the body is actually a blood glucose meter. Yeah, and she did it.
folks to a normal life as I can and live as long as I can without complications. So.
Well, I hope you enjoyed that as much as I did. And as the last thing the lady said is about living her best life, living a quality of life so that she can live as long as she can, even with her type 1 diabetes diagnosis. Okay, so I believe next week we will dive a little bit more into diabetes, because it's like an epidemic of diabetes, and it's all because of what we eat, what we're putting into our bodies. And I'm not gonna tell you what you can or what you cannot eat, but we're just gonna talk about next week like the symptoms and signs and what you should be looking for. And maybe I might even get a chance to have Miss Crystal come on and be with us on one episode. Okay, so it's your life, you love it, and make the best of it. That's what I always say. That's my motto. It's your life, you love it, and make the best of it. Don't forget to like, subscribe, ring the notification bell, and share it with someone. Okay, all right. And guess what? I'll see you on the next video. Bye-bye.